Woo! Good morning, you guys. I have a big topic for a 60-second tips and tricks on coping with chronic pain and also helping those who suffer from chronic pain. A little bit of education in the 60 seconds. I wanted to share the difference between acute pain versus chronic pain and how it works in the body and in the brain so that you guys can better understand kind of where a chronic pain person is coming from. So when there is acute pain or an acute injury, oftentimes, let's say we break our leg, we end up going into the ER, the pain is localized to the leg, and the doctors can quickly identify that there's a cellular abnormality or something that is showing up for the reason behind the pain. That's an acute injury. We can fix it. We know what to do. With chronic pain, what oftentimes happens is that there could be something that starts with an acute injury, and then the brain cells become very heightened, and our brain starts to tell us that there is pain for a long, extended period of time that we're having to cope with. What ends up happening is that in chronic pain patients, we are actually able to see brain abnormalities and different kinds of firing going on within the brain with a chronic pain person versus somebody who doesn't have chronic pain and is dealing with acute pain. There is literally a physical difference between the way that the brain works. Our sympathetic and parasympathetic central nervous system gets heightened. And it is in a constant state of distress. There are abnormalities that show up in a chronic pain person in those different areas. The other thing that tends to respond is somatic processing, which is thoughts and feelings and emotions and things like that. They're all tied together in this perfect storm where they're in a heightened state constantly. So what happens is that our brain gets very confused with what is going on and starts to pull together more pain senses when the somatic response is involved, or different emotions and feelings and things like that. It ends up creating a vicious cycle of a heightened pain sense in an individual. And oftentimes what we end up seeing is that in a chronic pain person, where the pain initially would have been in the broken leg for somebody with acute pain, now all of a sudden that broken leg it's healed, but there starts to be more pain. So it could be in joints. It could be in other areas of the body where it gets really achy, or, extensive pain signals in other locations in the body. And that's the brain's way of saying, I'm at a heightened state constantly. I'm constantly feeling pain. And so every single thing that I feel is going to be even more heightened than somebody who doesn't have chronic pain. I hope that helps you guys understand a little bit more about chronic pain. One of the best things that you can do for an individual with chronic pain who's experiencing pain all over the place is to look at what's going on in their life. Look at the stressors, look at their sleep, look at other things that could be impacting them as a whole person, and make sure that you are understanding now where the area of the pain has gone to, asking questions about it, making sure that you're checking those things out, very involved with doctors and things like that. But keep a journal and make sure that you're able to log where the pattern of the pain goes to, because that helps doctors really kind of hone in on and be able to provide some relief for the chronic pain person. I hope that that's helpful. I hope that you guys have a great day. Take care. Bye.